What's up, guys? I'm student Dr. Thompson. This is part 2 of a 3-part series on how to shadow a doctor. In part 1, I went over what is shadowing, why is shadowing important, and how to find good shadowing experiences. Stick around. This is part 2 where I talk about what to wear, what to expect, and what to bring with you when you go shadow. Alright guys, so what should you wear when you go shadow a doctor? You want to look nice. It's better to overdress than to underdress. Guys wear a tie, nice shirt, slacks, dress shoes. Girls, it's probably appropriate to wear a dress or dress pants and closed-toed shoes. Then when you get there, you can kind of feel the environment. Sometimes if the doctor's not wearing a tie, I'll take my tie off. They may even ask you to kind of dress a little bit, they may make a comment about how you're dressed too nice. If you're in the ER, you may be asked to wear scrubs or something like that. Okay, so what should you expect when you go shadow a doctor? First of all, you're probably going to sit down with the doctor and get to know you experience will take place. The doctor wants to know who you are. I would take time before you go shadow to prepare answers to questions that might be common, like, why do you want to be a doctor? Why do you want to go to medical school? Why are you interested in shadowing me as a primary care doctor? You want to make a good first impression, and that's your time to shine. In part 3, I talk about how to get letters of recommendation, and having those good first impressions makes it a lot easier to ask for a letter of recommendation. But stick around for part 3 when I talk more in depth about that. So the doctor will probably go over what to expect for the day before you start seeing patients. And then as you go into the first patient encounter, there may be an awkward moment there of, like, where do I stand? Do I sit? The doctor's sitting. Oh no, there's no chairs. I would say, to play it safe, stand as close to the doctor as you can without invading his or her personal space. I do that for 2 reasons. I like to see what the doctor's writing down about the patient, and I also like the patient to look up at the doctor and see me at the same time, rather than kind of sharing their time between looking over at me and then looking back at the doctor. Sometimes the doctor will ask a question and the patient will respond. The doctor picks up his pen, puts his head down, starts writing. Then all of a sudden the patient's like, who am I talking to? And they look right at you, the kid shadowing the doctor. If you're standing by the doctor, it's less awkward. So it's probably not that big of a deal, but just, my 2 cents on that. And as you go into patient rooms, the doctor will introduce you and ask permission if it's okay that you shadow. You may be expected to kind of, have some small talk with the patient here and there, but probably not too much. And then shadowing means that you follow the doctor wherever the doctor goes. Sometimes the doctor will just hop up without looking at you or saying anything. They'll head out of the room and you have no clue what's going on. It's safe to assume that you're supposed to follow the doctor everywhere unless the doctor tells you to chill out or to relax, or they're going to be right back. I've been in some situations where I got left in a room because I didn't follow the doctor, and it was me and the patient for like 10 minutes. So I would have wished that I followed the doctor in that situation. Okay, so what should you bring with you? I would bring a pen and paper. I'm going to tell you 3 things to bring. You're not expected to bring anything. But bring a pen and paper so you can write down questions that you have. And that way you can also filter those questions. You can kind of look and say, oh, that's an obvious question, or that's a dumb question, or that's a good question to ask the doctor. And then I would also use that pen and paper to keep a log of the patient encounters that you have, avoiding any information that would violate HIPAA regulations, and also ask the doctor if it's okay that you keep this log. But using non-identifiable information, keep track of the experiences that you see. Age, gender, chief complaint, and the plan that the doctor came up with for that patient. The second thing I would bring with you is Hippocrates. It's an app. It's an electronic application. So modern, right? It's an application for your smartphone or for your iPad, and it allows you to look up information about drugs, pills, right? Prescription medication. And that tells a lot about a patient. When you see a list of meds and you don't recognize them, after looking up those medications, On Hippocrates, you can tell exactly what this patient is being treated for. So it's a good idea to bring that. Again, not expected, but an added bonus to make some impressive comments. And then also, I would bring with you a stethoscope. Yes, a stethoscope as an undergrad. Okay, I didn't own a stethoscope. I didn't bring a stethoscope. But going backwards in time, I would buy a stethoscope and take it with me. Now, in medical school, you get a nice stethoscope, right? But in undergrad, you probably don't need such a nice one. In fact, you can get one for under 20 bucks that's pretty decent. And that way, as you go in and you're shadowing, when the doctor listens to heart sounds or lung sounds or blood vessel sounds, if you've got a stethoscope around your neck, the doctor will probably say, go ahead and listen. If you don't have a stethoscope around your neck, you probably just missed out on that opportunity. Occasionally you'll have that awkward moment where the doctor shares the stethoscope with you. I'm very appreciative of those moments, but there's always that question about earwax sharing that I don't like to cross. So again, you're not expected to bring anything, but I would bring paper, Hippocrates, and a stethoscope. Guys, that wraps up part 2 of the 3-part series on how to shadow a doctor. Stick around for part 3 where I talk about some important stuff like how to ask for a commitment to shadow the doctor multiple times, how to get a letter of recommendation, and then some small stuff like thank you cards and keeping detailed records for long-term use. Stick around. Again, thanks for watching.